Hi, I'm Catherine, and today I'll be talking with Kathy Beck, the Operations Manager of the Queensland Centre of Excellence in Autism and Intellectual Disability Health, called QCEIDAH of Queensland for short. So Kathy, what's been happening at the Queensland Centre?
Well, hi Catherine, and thank you for interviewing me for the second edition of the QCEIDAH newsletter. In this newsletter, we will tell you about our new Down syndrome clinic and what we've been doing there. You'll also meet a staff member, and we will tell you about the hard work that the research team's been working on with the grant applications and other projects.
So welcome to Meet a Staff Member section. So each newsletter it will introduce you to a member of our team, and you'll get to learn about our service and the people that's in our team. So this is Amy. So Amy, what is your role here at the Queensland Centre of Excellence in Autism and Intellectual Disability Health? QCEIDAH for short.
So at QCEIDAH, I am a clinical nurse and I have been working here for almost 6 months.
So I've noticed a little accent inside you, Amy. So tell me, where are you from?
So that is an accent you can hear. So I am from Scotland, and that is where I did my training. And I completed my nursing degree in learning disabilities.
What do you do in clinic?
So in the clinic, I help to coordinate the clinic, so make sure it runs smoothly. I also work really closely with the medical staff and the allied health staff as well. And as well, we see patients and we might help with some resources, such as bowel charts, sleep charts, and it just helps them through their journey as much as we can.
So what do you like doing in your spare time?
In my spare time, I like going walks along the river, mainly at sunrise if I can wake myself up in time. I like reading by the pool, and I also like to try and keep fit as much as I can.
Alright, so if you could have one wish for your own patients that see you, what would it be?
So my one wish would be that all the patients we see have the best healthcare outcomes, just like everyone else.
The Queensland Centre of Excellence in Autism and Intellectual Disability Health has launched a dedicated Down syndrome clinic here at the Marlow Hospital, South Brisbane. So the clinic happens every 2 weeks. So today I'm speaking with Dr. Melanie Johnston, who works in the Down syndrome clinic. So Melanie, what does the Down syndrome clinic do?
The clinic helps people with Down syndrome who've got complex mental health and physical health care needs. People can be referred when their regular treating team have tried to help them, but things aren't getting better.
So Melanie, what is your role in this Down syndrome clinic?
I'm a psychiatrist, so that's a doctor that helps people with their mental health. But I work with lots of different types of doctors and allied health practitioners in the clinic.
So why has QCEIDAH launched the Down syndrome clinic?
Down syndrome is the leading cause of intellectual disability in Australia and represents a large group of the QCEIDAH patient base. Our doctors and health practitioners have identified several healthcare needs that are specific to people with Down syndrome. So we hope that by having access to all of our clinicians in one place at the same time means we'll achieve good healthcare outcomes for our patients. This also means that we get to try out a new model of care that we hope to roll out to other patient groups in the future.
So who works at the Down syndrome clinic?
The clinic allows people with Down syndrome to be seen by psychiatrists, psychiatry registrars, general practitioner, nurses and allied health. The good thing about the clinic is that patients get to be seen by the right people at the same time for their problem.
So what can patients expect when they come to the clinic?
Patients will get resources that will help them have better health. They might get to see several of our health practitioners in a single clinic visit. Then afterwards, they and their carers will get a summary sheet of what was talked about during their appointment to help them remember and know what they need to do before they return to the clinic.
Today I'm speaking with Katie Booker, who is the research lead at the Queensland Centre. So Katie, what is Easy Health?
So Easy Health is our project where we're making online learning courses for health workers. So there's 4 modules which aim to increase the knowledge, skills and attitudes of the people who do it. QCEIDAH's got an extension from the Department of Social rollout of the project.
So who do you work with on this project?
So we're working with our partners, which include Queenslanders with Disability Network, or QDN for short, and Indelibility Arts. And we're working to keep making engaging and meaningful education which will help people with intellectual disability and autistic people get better healthcare. And through that project, we're also employing 2 people with lived experience as research assistants. And what we're really trying to do in this extension is work out ways so that everyone can access our training. That's currently a bit of a problem.
Right. So, Katie, so what has the research team been working on recently?
So Kathy and me and the rest of the research team have been doing a lot of grant writing since the last newsletter. There was a MRFF grant round, which stands for Medical Research Future Funds, which was just around improving healthcare for people with intellectual disability. So we put in an application for that round to make it a tool to help health workers assess mental illness in people with intellectual disability. And we're going to soon submit another grant so that we can test out different treatments for people who